عليكم السلام. تفضلي بقى.
نعم. I will talk today about the brain vasculature. I will start with the arterial blood supply of the brain. We have two main circulation: the anterior circulation from the internal carotid artery, and posterior circulation from vertebro-basilar artery. The arterial supply of the CNS is derived from internal and vertebral arteries, and there is anastomosis between internal carotid and external carotid artery, but little or no supply to the normal brain from external carotid. First, the internal carotid artery. I will show the pointer. Yes, the internal carotid artery come from the common carotid artery, and the bifurcation of the common carotid artery occur between C3 and C5, or between the hyoid bone and superior border of thyroid cartilage. The internal carotid artery has 7 segments. The first segment, which is C1, it is a cervical segment. From its origin until its entrance to the skull, this segment has no branches. The second segment, which is the petrous segment, it has a vertical part, genu, and a horizontal part. This segment has 2 branches. The artery of pterygoid canal, which has anastomosis with external carotid artery, and the caroticotympanic, which supply the middle ear. The third segment, it is a short segment where the internal carotid artery pass superior to the lacrum, the foramen lacrum, so it is called the lacrum segment. This segment also has no branches. The fourth segment, it is the cavernous segment, and it has 2 main branches or trunks: the meningohypophyseal, which give tentorial branches by basal tentorial and marginal tentorial branches, also in the inferior hypophyseal, which supply the posterior part of the pituitary gland. And we have the inferolateral trunk, give meningeal, cavernous, and neural branch to supply the cranial nerves. After its exit from the cavernous sinus, it gives also short segment medial to the anterior clinoid process. This segment also has no branches. So the odd numbers C1, C3, C5 has no branches, while the even numbers has branches. The exception is C7, which has the branches. After its exit from the cavernous sinus, it will give the ophthalmic artery, and it enters the cranial cavity and gives the ophthalmic artery. This artery is an important artery, and it is prominent in the angiograph. This artery passes infero-lateral to the optic nerve in the optic canal. Also, in this segment, we have the superior hypophyseal artery. This artery gives branches to supply adenohypophysis, pituitary stalk, and optic chiasm. Then lastly, we have the 7th segment. This segment, it is called the communicating segment because it gives the posterior communicating artery and this one, and the anterior choroidal artery. The anterior choroidal artery give supply to limbic system and posterior limb of internal capsule. Then it will divide to anterior cerebral and middle cerebral arteries. This MRI showing the internal carotid with its segment. This one, the cervical, the petrous, the lacrum, and the cavernous. This cavernous this part is the carotid siphon in the cavernous sinus. This one is the clinoid, and this one is the ophthalmic. This is the ophthalmic artery anteriorly. Then this will end to form the middle and anterior cerebral. The anterior cerebral artery arises from the internal carotid artery and the anterior perforated substance and pass anteriorly superior to the optic chiasm. It went around the genu of corpus callosum and pass posteriorly on its superior surface to supply the medial and superolateral aspect of the cerebral hemisphere, posteriorly as far as the parieto-occipital surface. We have segments of the anterior cerebral artery. The first segment is called the pre-communicating segment from its origin to the anterior communicating artery. This segment gives the medial lenticular striate arteries, and the largest one, it is called the artery of Hebner. These give branches or supply to the caudate, lentiform, and anterior limb of internal capsule. This artery has, the artery of Hebner has variable origin, sometimes from A1 segment or A2 segment. A2 segment from anterior communicating to the genu of corpus callosum. And this segment gives the orbitofrontal branch, supplying the medial and inferior part of the frontal lobe, while the frontopolar supply the polar part of the frontal lobe. After the genu of corpus callosum, the anterior cerebral artery will form the pericallosal artery. It is superior to the corpus callosum, and also the callosum marginal, which run in the cingulate sulcus. These are important branches. This is angiography showing the internal carotid. It's the ophthalmic artery here, and then its division to give the anterior cerebral. This is the pericallosal, superior to the corpus callosum. This is the callosum marginal. Here are the frontopolar. This image showing the how the anterior cerebral pass in the interhemispheric fissure, while the middle cerebral goes laterally. This angiography also showing these important branches. Then we have the middle cerebral artery. This is the largest and most direct of the branches of the internal carotid artery and is therefore the most prone to embolism. It passes laterally and ends as a branch on the insula, the overlying opercula, and most of the lateral surface of the cerebral hemisphere. Here is the insular cortex, the operculum like lids, and this is the Sylvian sulcus. This image shows the course of the middle cerebral artery. It is directed laterally, also has segments. The first segment, it is a horizontal segment. It gives the lenticulostriate arteries. These are the lateral, while these are the lateral, and it gives supply also to the caudate and the anterior part of internal capsule. This then the M2 segment, the insular and opercular M3, superior trunk and inferior trunk, and end as cortical segments. As it is past the superficial supply the cortical, give the cortical branches. These branches, orbitofrontal, parietal, and temporal, or also angular arteries. This is a simplification of its course and segments. M1, M2, insular, opercular, and cortical. MRA showing the internal carotid, and this is the middle cerebral, M1, M2, M3, and the cortical branches. Now, the vertebro-basilar system. First, the vertebral artery. This artery is the first branch of the subclavian artery. It ascends through the foramen transversal of the first 6 cervical vertebrae and ascend vertically. And after its exit from C1, it will pass posterior to the lateral mass of C1. Then it ascends to enter the foramen magna, and it unites with its fellow to form the basilar artery at the lower border of pons. Also, it gives branches. It has meningeal branches supplying bone and dura in the posterior cranial fossa, posterior spinal artery, anterior spinal artery, and the medullary branches. And the largest one is the posterior inferior cerebellar, supplying the cerebellum, medulla, and choroid plexus of fourth ventricle. This MRI showing the subclavian, and this is the vertebral artery ascend vertically, then posteriorly, and medially to form the basilar artery. This NGO showing the vertebral artery, giving the largest branch of it, which is sometimes called pica, the posterior inferior cerebellar. And then we have the basilar artery formed from the fusion of 2 vertebral arteries at the lower border of pons. Then it ascends in the basilar sulcus in front of pons and end at forming the posterior cerebral artery. This picture showing its course and the branches. We have here anterior the branches of the basilar artery, anterior inferior cerebellar, pontine arteries, and superior cerebellar arteries, and posterior cerebral artery. We have the oculomotor between posterior and superior cerebellar. If there is an aneurysm here, it causes oculomotor pulse. Here we have angio showing the vertebro-basilar system supplying the cerebellum. The posterior supply the posterior surface. The anterior inferior supply the lateral and anterior part, while the superior supply the superior part. And it ends as the posterior cerebral, and here is the posterior communicating artery. It's a frontal view showing also the vertebral arteries and posterior inferior cerebellar. It is larger in caliber than the anterior inferior. Also, the posterior cerebral larger than superior cerebellar. Now the posterior cerebral artery, which is terminal branch of the basilar artery. It mainly supplies the occipital lobe, the inferior-medial surface of the temporal lobe, midbrain, thalamus, choroid plexus of third and lateral ventricles. It takes part in the formation of circle of Willis. Also has segments, the P1 segment from its origin till posterior communicating artery. It gives the thalamo-perforating arteries, which supply the thalamus. We have a second segment when it went around the midbrain in the ambient cistern. It gives choroidal branches to the choroid plexus and midbrain and thalamus, also to the pineal gland. We have splenial artery, also branches to parietal, occipital, and temporal. And the last segment located in the quadrigeminal cistern, and it gives occipital and calcarine arteries. These two circulations form the circle of Willis, which is an anterior arterial polygon, heptagon, formed as the internal carotid and vertebral system anastomose around the optic chiasm and infundibulum of the pituitary stalk in the suprasellar cistern. The communicating pathway allows equalization of blood flow between the two sides of the brain and permits anastomotic circulation when a part of the circulation be occluded. This is the circle of Willis. Here is the internal carotid giving the interior, and this is the interior communicating. And this is the posterior cerebral from the basilar. And this is posterior communicating from internal carotid. Also, MR angio showing the anterior cerebral, interior communicating, posterior and posterior communicating. Another review. The radiological features of the arterial supply of the CNS. In the plain radiographs, the arteries are not visible unless calcified. This most commonly occur in the carotid siphon near the pituitary fossa. The angiography, this can be achieved via the aortic arch by a single femoral artery injection. The internal or common carotid arteries are catheterized in turn, and the views of both vertebral arteries are usually possible via contrast injection into one vertebral artery with retrograde filling of the other from the basilar artery. In CT and MRI, contrast enhancement aids visualization of vessel on CT scanning, while in MRI we don't need contrast. Vessels in cisterns are particularly well seen on T2 weighted images because of the difference between the relaxation contrast of CSF and that of the vessel wall. MR angiography allow direct visualization of the circle of Willis and its branches without contrast injection. In this T2 MRI, we can see the basilar artery in front of the pons in prepontine cistern. Also, this MRI showing the part of the circle of Willis. This is the interior cerebral, and this is the posterior cerebral artery. And as I said, the P2 segment in the ambient cistern as it went around the midbrain. This is an example of perianeurysm. It is located in the top of the basilar system. Ultrasound examination of the neonatal brain. The collagen sheath of vessels give them echogenicity. On real-time studies, pulsation of the middle cerebral vessel can be seen in the insula, and we can see the anterior cerebral artery and pericallosal and calloso-marginal. And this is the anterior cerebral. This is pericallosal. This is calloso-marginal. And here the circle of Willis can be visualized. This picture showing the major territories supplied by the major arteries. The middle cerebral artery supplied the lateral aspect, while the anterior cerebral artery supply the anterior and medial aspect. of frontal and parietal, and the posterior cerebral supply the posterior and inferior part. This give us a hint about the occluded artery when we see the infarction. This is the territory of the anterior cerebral, this one. And here, infarction of the middle cerebral. And this one, posterior and inferior part by occlusion of posterior cerebral artery. We have what is called the watershed infarction, because it is between regions supplied by major vessels, major arteries. This one between anterior cerebral and middle, this one between the middle and posterior cerebral. It is important because it approximately comprise 10% of all ischemic stroke. Now I will talk about the venous drainage of the brain. The dural venous sinuses are venous channels located intracranially between two layers of the dura mater. These are the sinus between the two layers of the dura. This is the endosteal layer, and this is the meningeal layer. It receives blood from a brain and also from the skull by diploic veins, and from the scalp by emissary veins. It also, the CSF also has a drainage here by arachnoid granulation. Unlike other veins in the body, they run alone and not parallel to arteries. They are valveless, allowing for bidirectional blood flow from and into intracranial veins. The major drainage is to internal jugular vein. This picture showing the superior sagittal sinus from crista galli to occipital protuberance, and the inferior sagittal sinus in the free border of Farks cerebri, form with vein of Galen, the straight sinus. We have the occipital sinus, a drain in the confluence of sinuses, then to the transverse sinus, the sigmoid and internal jugular veins. We have the cavernous sinus. It receives blood from sphenoparietal sinus and the drain to the by superior petrosal sinus to the transverse, and by inferior petrosal sinus to the internal jugular vein. Cavernous sinus, it is an important sinus located on either sides of pituitary gland and the body of sphenoid bone, connected across the midline by intercavernous sinuses. It lies between layers of dura mater. There is multiple structures pass through the sinus. We have the internal carotid, and inferolateral to it is the abducent nerve, and laterally we have multiple nerves, the third, fourth, and ophthalmic and maxillary division of trigeminal nerve. This is MR venography showing the superior sagittal sinus, the inferior sagittal sinus with vein of Galen forming the straight sinus, and then transverse and sigmoid. It has a S shape, and then jugular vein. We have two systems draining the blood from the brain, superficial and deep. The superficial, we have superior cerebral veins drain to the superior sagittal sinus, and the largest one is the superficial middle cerebral vein. This vein has anastomosis with superior sagittal sinus by superior anastomotic vein of trollard, and anastomosis with the transverse sinus through the inferior anastomotic vein of Labi. This vein then drain to the cavernous sinus. This is vein of trollard, and this one is the vein of Labi, drain to the transverse, and trollard drain to the superior sagittal sinus. This another MR venography showing the vein of trollard and vein of Labi. Those are the superficial veins. We have the deep cerebral veins, drain the deep white matter and the gray matter that surround the basal cisterns and ventricular system. The deep veins are responsible for the outflow of approximately the inner 80% of hemispheres. We have the thalamostrate vein in the floor of the lateral ventricle and the choroidal vein along the choroid plexus of lateral ventricle. They both form the internal cerebral vein, which then drain to the great vein of Galen. The internal cerebral veins lie in the velum interpositum in the roof of the third ventricle alongside the median posterior choroidal arteries. Posteriorly, they enter the quadrigeminal cistern and soon join the great cerebral vein. Here, the internal cerebral vein form the cerebral vein, the great vein of Galen. And we have another veins. These are also deep veins called the basal veins of Rosenthal, formed from fusion of anterior cerebral and middle deep, also called the deep sylvian vein, from the basal veins wound around the midbrain. Also join the vein of Galen, which then with inferior sagittal sinus drain to the citrate sinus. These are the basal vein from anterior cerebral and deep middle cerebral or sylvian. From the basal vein, join with internal cerebral from the vein of Galen. This vein is short, 1 to 2 cm, below the splenium of corpus callosum, with inferior sagittal sinus from the citrate sinus. This angiography showing the venous sinuses. Here, the superior sagittal sinus. This one is the inferior sagittal sinus. We have what is called the venous angle from superior thalamostriate vein to form the internal cerebral vein. It is posterior to foramen of Monro. This is the internal cerebral veins forming the great vein of Galen, with inferior sagittal sinus from the citrate sinus. This is the confluence of veins of sinuses, and this is transverse. This is sigmoid, and this one is internal jugular vein. This is cavernous, which drain to the internal jugular vein by inferior petrosal sinus. We have the veins of the posterior fossa, the pontomesencephalic vein anterior to the pons, drain inferiorly to the petrosal vein, superiorly with the posterior mesencephalic vein to the great vein of Galen. The superior vermian vein also to the great vein of Galen, while the inferior vermian vein to the transverse sinus. Radiological features of the cerebral veins and venous sinuses. On skull radiograph, the course of venous sinuses can be seen where they groove the inner plate of the bone. And in MR venography is the primary non-invasive method of demonstrating the cerebral veins and venous sinuses. We also use the angiography. During the venous phase, the superficial veins are seen to fill before deep veins and frontal veins before posterior veins. Also, we use CT and MRI. The tentorium and fax are seen as relatively hyperdense structures owing to the venous sinuses that they enclose. And venous sinuses may also be seen at the internal occipital protuberance. High division of the superior sagittal sinus may occur as an unusual normal variant and should not be mistaken for sinus thrombosis. In higher slices, the posterior end of the internal cerebral veins and great cerebral vein may be seen in the quadrigeminal system. This is an example. We have an empty delta sign. It's seen in contrast enhanced CT. This sign consists of triangular area of enhancement with relatively low attenuating center, which is the thrombosed sinus. And the dense clothed sign, this is the transverse sinus thrombosed and give dense signal. Thank you very much. Any questions?
شكرا جزيلا دكتورة زهراء عشتيدك. طريقة الإلقاء
Number 1. دكتور أكو صوت؟
نمبر 1 دكتورة نختار نور محمد جواد.
اي نعم أستاذ. Number 1 هي superior sagittal sinus.
اوكي. دكتور أحمد خليل.
نعم أستاذ. Number 2 is inferior sagittal sinus.
inferior sagittal sinus. دكتورة هبة عماد.
نعم أستاذ.
نمبر 3.
Number 3 internal cerebral veins.
internal cerebral vein. من الانتيريور continuation مالته يسوي انجل. تشوفيها؟
الأنجل دكتور؟
اي هذه.
نعم أستاذ.
شو هاي من يسويها الانجل؟
نعم أستاذ.
اوكي. نمبر 4 دكتورة دعاء.
نعم. vein of Galen.
vein of Galen. دكتورة جزان.
نعم أستاذ.
نمبر 5.
Straight sinus.
straight sinus. نمبر 6 نور بابا علي.
نعم أستاذ. This is confluence of the sinuses, site of confluence of sinuses.
This is the confluence of the superior وال straight sinus سواء يطلع منهم الترانسفيرس. اكو بعد لو خلصتي؟
لا اكو.
رنين رفعت. نمبر 7.
Number 7 transverse sinus.
This is the transverse sinus. Number 8 رقية سعد.
نعم دكتور. sigmoid sinus.
This is the sigmoid sinus. أخير شيء بقى دكتورة شيماء علاء مكي.
internal jugular vein.
internal jugular vein. أستاذ محمد كمل الارتريال سيستم.
نعم. رقم 1 محمد مهدي.
نعم أستاذ. right vertebral artery.
right vertebral. نمبر 2 عمر فهمي.
نعم أستاذ. left posterior inferior cerebral artery.
نمبر 3 زيد يوسف.
نعم أستاذ. البازلر artery.
بازلر artery. نمبر 4 لارا.
نعم أستاذ. left superior cerebellar artery.
نمبر 5 سالي عبد الرضا.
نعم أستاذ. right posterior cerebral artery.
هاي دكتور.
عايشة